and welcome to Step Up TV Morning Show. Step Up Nigeria is a creative team building bridges for effective governance to tackle corruption and improve service delivery in Nigeria. To learn more about the work that we do at Step Up Nigeria, please check out our Step Up Morning Show episode 1 as well as our introduction to our channel video. Welcome! The whole world is still fighting the coronavirus disease, and we hope that you're still adhering strictly to the lockdown protocols that are in place, that you're staying home if you can, and if you're going out, that you're taking the necessary precautions. All in all, we hope that you are safe as you watch this episode. Corruption has undermined the fight against the coronavirus disease. On today's episode, we will be discussing the real cost of corruption on Nigeria's healthcare system and why tackling corruption is crucial to Nigeria's coronavirus response. Nigeria's healthcare system faces many challenges. Over the years, funds have been routinely mismanaged, and COVID-19 has exposed the gross neglect of healthcare altogether and Nigeria's healthcare sector to be specific. C. The National Health Insurance Scheme used 161 million naira for international travel without any evidence or approval from the head of service of the Federation. Where did those monies go? What happened to all the mismanaged funds? Why is no one asking all these all-important questions? Who spent all this money? These are monies that should have been used to take care of healthcare issues in rural communities as well as urban areas. But because of mismanagement of funds, now that there's a pandemic that actually requires that these hospitals be working at full capacity, we're stuck. And then there's petty corruption. Petty corruption amongst healthcare workers themselves poses a major threat to easily tackling this coronavirus pandemic. The corrupt system allows medical staff to sell medication at exorbitant prices, and frankly, Medicare is even the least of it all. We hear of sales of chairs to sit in the waiting lounge and beds for the sick in the hospital. People even have to pay some money to see doctors on call in the hospitals. I mean, how bad does it really have to get? Then don't even get me started on the issues of human capacity development and the overall competence or lack of it thereof and lack of integrity of the staff in these hospitals. Now, don't get me wrong, I am not speaking of all the medical staff in Nigeria, neither am I speaking of all the hospitals and primary healthcare centers in Nigeria. I'm speaking of the ones that the 2016 audit report specifically reports about and issues that we have heard from interactions with people who use public healthcare in Nigeria. This ineffective staff stem from a system of corruption that starts from unmeritorious recruitment, combined with poor structures and weak sanctions and reward systems in our hospitals. As regards the coronavirus pandemic itself in Nigeria, issues of poor data capture, ghost workers, porous borders, illegal movement between states, and a lack of statistics for adequate planning make an already difficult job much harder to do. We need public healthcare systems that work for everyone, the rich and the poor alike, and we need to empower communities to take up advocacy for improved healthcare service delivery in their communities. I mean, that was a serious episode because we're facing a very serious problem. Thank you so much for watching this episode of Step Up Morning Show. I have been your host, Fermi Adeola. Hope to see you in our next episode. Until then, please stay safe. Please remember that we have a podcast series currently going on COVID-19 and corruption, as well as the impacts on actual service delivery and the real cost of corruption in Nigeria and the importance of staying home and being a person of integrity in these times and saying the truth about your whereabouts and who you've met. All of that good stuff is on our podcast. We will link our podcast in the description. Please visit our podcast, which airs on iTunes, Stitcher, Podbean, SoundCloud, and on our blog. And listen to past episodes and share and like. Before you leave, please remember to give us a thumbs up if you like this video, share with your friends and family, as well as subscribe to join the Step Up TV family. Until our next time, stay safe.